COVID experience that we've been having. We right now don't do COVID-19 testing at our facilities, but we knew that people were going to be having critical health needs even during the epidemic. So we felt like it was really important to work as hard as we can to keep our centers open safely. And we actually, you know, we weren't sure what to expect, but we saw that the numbers of patients dropped by about 40%, which was actually much less than what we were anticipating, and saw that, of course, even though there's COVID in the land, to show this as, there is still all these other existing health needs that people had. So I've been really grateful for our teams at the centers that have, you know, worked really hard to put all these new safety precautions in place and showed up every day to continue providing this really critical diagnostic care for people that are dealing with all of the non-COVID related health issues, in addition to all of the new challenges that COVID has brought. So that was kind of one of the first big pieces for us, was figuring out, okay, how do we keep providing a great service even in the middle of a pandemic? For us, that had a lot to do with working with our staff and relying on their own expertise and knowledge, which, as Shoga said, we really focus on providing a great clinical experience and a great patient experience. And as a result, we hire people that have both of those things in mind. And I think we were really able to see the resilience and the expertise in our team come out as part of this epidemic. So we kind of did a whole rehaul on what our center processes look like, on what cleaning and sanitation looks like, providing PPE for all of our staff, of course, social distancing within the center, hand washing, all of that good stuff. And working with our teams there, we've been able to keep the centers open. And actually this month, although we are still seeing record number of new cases almost every day here in Nigeria, our patient numbers are almost back to where they were in March. So it's been interesting to see kind of the initial shock of COVID here, and then this kind of shifting back into what is now a new normal. So I think that's
I think the lockdown probably,
yeah.
I think one of the things that caused the 40% drop was the lockdowns, the national lockdowns, kind of like stop people from moving around. So the only people we got was people with critical cases. So
yeah.
So, but as soon as things started to open back up, people that had to get to a diagnostic facility came. So, and I think that's something that,
yeah, it's also something where like the patient trust comes into play, because there is definitely fear here right now around going to a hospital or a clinic. So that's where it's really important to have that relationship with the patients and to be able to demonstrate and communicate to them that as a healthcare facility, we're doing everything we can to make sure that a trip to the diagnostic center isn't going to put you at a higher risk. So that's been kind of the first phase as we as a team were thinking about, you know, how do we handle this crisis, was working with our teams, and been grateful to keep those centers open. The kind of next thing that we were thinking about was the need to dramatically increase testing capacity here in Nigeria. So in the early days of the epidemic, the capacity to test was just super, super low. The main focus in the beginning was on contact tracing, which I think works really well when you have just a small number of cases. But then in a country like Nigeria, where you have these mega cities with 20 million people here in Lagos and 200 million people across the country, that quickly becomes a less feasible way to manage the epidemic overall. So we were starting to see this shift in the middle of March from still having the contact tracing approach and trying to restrict who's coming into the country, but then a movement toward thinking about how we can really expand testing capacity and expand treatment capacity in the country. So we have been thinking a lot about, okay, how can we play a role in this? How can we kind of leverage our expertise in healthcare operations and in the diagnostic space? And what we ended up doing is kind of our first effort in this testing capacity project was partnering with one of our local investors here, who's called Flying Doctors Investment Group. And we were able to partner with them to launch the first booth-based testing facility in Ogun State. So that's a state that borders Lagos State, where Lagos is the epicenter here. So that was a state that was at high risk because of its proximity to Lagos, but also has a lot fewer resources than Lagos. Lagos is you usually call it like the most successful state in some way. Just has a lot of the money is concentrated here, as it is the commercial center for the country. So we were able to open up this booth-based testing facility. So you guys have probably all seen the booths at one point. They were modeled after some of the booths actually in Boston at like Brigham and Women's. So it's kind of the little telephone booth approach where the lab scientists can stick their hands through, but has a full sheet of glass. They're fully isolated from the patient. So that helps kind of reduce the need for all of the PPE, because that's one of the biggest expenses that we've seen here, is just making sure people are kitted out appropriately and aren't going to get infected from collecting these samples. So we were able to work with our investor to choose the one who designed and built this first booth that we were able to put at the Ogun State testing site. And then we also worked really closely with the Ogun State government, which for us was relatively new. We work, I'd say, with one-on-one with a lot of public health facilities, but hadn't done as much work with state government level. And so this was a really great opportunity for us to get to know the state government and the Ministry of Health in Ogun State better, and to work with them to put this whole project together. And right now, almost all of the staff that we have at the testing site are state employees and have been trained by the state on how to identify patients that need testing and how to actually conduct the tests. So I'd say that's been something that was just a really great experience for us to get to work with this kind of diverse team of private and public sector, to get to do something new and innovative for the country in this booth-based testing, and show that we were able to reduce the costs of actually running one of these sample collection sites. And then got to work with a really great team of public sector employees to pull this off. And so we've been running, I think we get our daily reports, I think it's like day 35 of running that facility, and we've collected over 1,000 samples from that site alone, which has been really, really cool to just feel like we're able to have some small impact on increasing the capacity to run these tests. So this is a sample collection site, so it's the swabs, which are then packaged and sent to a state molecular lab to be run. So that's kind of the role that we felt like we could fill well with our operational expertise, is figuring out, how do we set up a sample collection site in a way that is efficient and in a way that we're able to keep everybody safe, and help just get a lot more samples being collected and moved into the public sector chain of the molecular labs. Right now, almost all of the labs are state labs that are processing the samples. So I think, unlike in South Africa, where it's a combination of public and private, it's been very heavily in the hands of the public sector here. So that has made it even more important for us to build these relationships with the public sector for this particular project. And then as we were working on setting up this first site, we realized we were creating all of these resources, like training resources. We were doing a ton of research into what's been working well in other parts of the world. So we ended up making all of the information that we collected and all of the manuals that we created in that process, we made them all public and freely available online, so that other folks that are working in similar settings could at least have this kind of initial template for what it looks like to think through and set up and operate a sample collection site in a resource limited setting. So that was kind of our first offering, and way that we felt like we could take the many, many hours that we spent thinking about and setting up this site, and hopefully get that into the hands of other people that can then use those resources and not having to kind of reinvent the wheel every time. So that was the site we put up, which is COVID-19.mdaas.io, if you are interested in checking it out. So that was another one of our kind of early projects, was getting that out there and trying to share it with as many people as possible.